Hi, I'm Dr. Megha from Aster CIM Hospital, consultant neonatologist, and today we are joined with Dr. Parimala, senior consultant neonatologist from Aster CIM Hospital. Hello, ma'am.
Hello.
Today we are going to discuss about common newborn problems, what we encounter, like most of our new parents encounter. So, can you tell us any of the common newborn problems what we can see in a newborn baby, ma'am?
It's basically like when you worry, which signs when you see in a baby, when you should worry and go to hospital. So because babies can't talk, you have to watch out for these ones. First is like when the baby doesn't feed properly and looking very tired. Usually active crying baby suddenly looks very tired, or the baby actually has a fever. Babies generally don't have fever, so if they have a fever, it's significant. Sometimes they may look extremely cold. They look blue and cold. So these are signs that you should worry and go to hospital immediately.
Okay, these are the general problems which you mentioned. System-wise, there are many of the babies, they come with a lot of lung problems. What we see commonly is the nasal blockage, which can be relieved by simple saline nasal drops. But apart from that, what are the other lung problems what we can see in the baby and how the parents can identify it?
The lung problems in babies are same as like what we have as adults, because just that the size is small but they suffer with the same diseases. The thing is, it can range from just simple common cold to severe pneumonia also. So when they should worry that the whatever problem they're seeing is very serious is when the baby looks blue. Definitely that is a serious problem. Otherwise, when the baby is breathing, if the chest looks like it's going inside, so that also shows that lungs are involved. Other thing, if because of COVID now everybody has a saturation monitor at home, so pulse oximeter. So if the saturations are less than 95 consistently for the baby, that's a serious problem. So if these are there, then definitely you have to go to hospital.
A lot of our newborn babies, they do suffer from tummy problems like colic due to lot of gas and cramps, and so many of the times they have this lot of excessive crying. So what kind of an excessive crying should be parents bothered about, and when they have to come to the hospital?
Gas is very common in babies because they are only on liquid diet, which is milk, which is rich in protein, which converts into gas in the end of the day. So many parents panic when the baby strains or makes that very loud noises to just pass gas. They should understand that babies don't have control over the body parts. So just when they think they cannot pass the gas or they can't pass motion or urine, so the way they learn to pass that is by straining like this. So if they put that much of pressure, automatically tummy pressure increases and the gas and motion, everything comes out urine. So for that they need not be scared. When they should worry is some babies have colic. Colic also is a simple thing. Like a clockwork, they cry on the same time every day. And they cry for half an hour. At the end of half an hour, they're back to normal. So if something like that, which settles by just rocking, taking them around, just going for a ride, simple things can settle that. So if that is there, even then they need not panic. But if the baby is crying as if the baby is in pain, beyond half an hour, the baby is not settling down. Or the baby vomits and the vomit is looking greenish. Or the tummy looks really tense and bloated, and if they touch the tummy, baby seems to be in pain and screams a lot. Or if the baby has not passed motion for more than 4-5 days, or if they see blood in motion. So these are indication that baby has some serious tummy issues. So if they see this, then they need to get the baby to be seen.
Apart from that, some of the newborns, they do even suffer from ear problems. So what are the signs parents have to look for to identify it is an ear problem in the baby?
Yes, that's a good question, because for babies what happens is the nose, ear and the throat, it all lies like a T in one line. So if they have a simple nose block, simple cold, then the same infection transfer to the ear, and babies can have ear infection as well. So the obvious way for mothers or parents to know that baby has a ear infection is they see discharge coming out of the ear. It can be whitish, pus-like, blood sometimes, even watery sometimes. So if they see something coming out of the ear continuously, that means baby has ear infection. Sometimes if it doesn't come out and stays inside, then the babies suffer with extreme ear pain. In that case, they just scream loudly and will not be able to console. So if that happens with a fever or without a fever or a cold, then that also shows that baby has a ear infection and needs treatment.
Other than this, many of the parents complain about rashes on the newborn skin, and as many of the parents they use these commercially available soaps and powders, these newborns have rashes. So when would these rashes be bothersome to the parents?
So many babies suffer from what we call as atopy or dry skin or eczema, because of which they see these rashes, angry looking red rashes, sometimes skin peeling, sometimes severe itching, which makes a baby little cranky. So this is because of atopic dermatitis. Simple thing like avoiding any commercial soaps and lotions and using only medicated bars and lotion will clear this off. Other than that, the other rashes are erythema toxicum, what we call. Newborn babies have those rashes for a week or two. Again, this will disappear on its own. So using only cotton clothes and avoiding synthetics will settle this down. And nappy rash is very common as well. Avoiding wipes, wet wipes and commercially available things. Using cotton with water to clean and applying little oil like a lubricant, coconut oil or olive oil will take care of the nappy rash. And even prescribed rash cream will avoid this. But when they should worry about a rash, which rash is really worrisome is, they can use a test called glass test. You take any glass tumbler at home and press on the baby's skin where the rash is there, in the hand or on the chest where you see the rash. When you press, the normal rashes which are non-worrisome disappears. But if you press and you're seeing the rash through the glass, that means the rash is not disappearing with pressure. That rash definitely shows that baby is suffering from some disease and you need to get medical attention.
Thank you, Dr. Parimala, for sharing such a vital information. Thank you.
Thank you.